Hi, myself Devini. We are Group 1. So I'm here to presentation. The presentation is about focus on children's persistent diarrhea following milk consumption. There's a common concern in pediatrics that can result in the compromised nutritional status, so impaired growth and diminished overall health and quality of life. The incidence of the true milk protein allergy occur in approximately 3% of the infants in Malaysia, while as many as one third of youngsters with severe gastroenteritis can develop a temporary lactose intolerance due to damage in the intestinal lining caused by persistent diarrhea. And many different disorders can contribute to the symptoms similar to those described above. So lactose intolerance results from the lack the enzyme lactose, resulting in excess amount of undigested lactose that fermented in the colon and cause gas and abdominal discomfort. Secondary lactose intolerance occur for the temporary period following an infection or inflammatory process that damage the intestines. Milk protein allergy is an immunological response to the proteins found in the cow's milk, while the irritable bowel syndrome refers to the bowel hypersensitivity without any structural pathology. The overall margin of intentional food disturb in the contains common protein and estimated value in the slide above. The full statistic shown in the slide. So they are overly 30% of the child in the developing ratio with the diarrhea lasting of 14 and more days will have the condition caused by product to the intentional lining attribution to contavirus or other pathogenic pathogens. Thank you. Thank you.
For emergency, lactase supplement, example drop or tablet taken over the counter medication just before consuming dairy. Short-term limitation is take away all dairy for 2 to 4 weeks to allow the villi in your intestine to return and lactase to start being produced again. For treatment, dietary change substitution of lactose-free milk or cheese. Try hard cheese such as Swiss for the lower lactose content. Slow introduction, it may be that some children are able to tolerate small amount of yogurt containing live culture, which aid in the digestion of lactose. Heal the gut. Address the root infection or any other inflammatory disorder. Treatment: low FOD MAP FODMAP diet, identifying specific carbohydrate that trigger the child. Stress management, since the gut-brain axis is heavily involved in IBS. Managing school or social stress can reduce diarrhea episode. Probiotic specific strain may help regulate the gut microbiome.
For homeostasis is undeformed internal state as to perform mechanism function. Example of app based on enzyme lactase to break down lactose in glucose and galactose, then absorbing. The disruption are acknowledged in lactose level are low. Undigested lactose remain in the intestinal lumen. As this, the body low water and electrolytes faster than it can replace the threatening fluid homeostasis. The homeostasis step multifunctioning cause severe enzyme deficiency, intestinal damage, immune overacting or abdominal gut signaling. In conclusion, making a correct diagnosis is critically to allow approach dietary management and avoid unnecessary complication. In our study is about the fundamental issue of healthy lifestyle of child in milk consumption. This survey allow us to know that many students not consider a healthy lifestyle. Overall, every year millions of kids around the world still get hit with serious long-lasting diarrhea after drinking milk. In most cases, gut infection, especially in poor areas, damage the body ability to handle lactose. Based on doctor study, address as this secondary lactose intolerance. Yet not the problem. Up to 7% of infants worldwide have their immune system go to milk protein, which is just add to the gut chaos. This is permanent issue which start from years to until years. This is maybe there because less chance to for confirmation of tool reduction substance or hydrogen test. This result as well of for quick relief. To prevent malnutrition through the avoidance of food that doesn't provide the necessary nutrient, consult with a pediatrician. Direct and non-invasive method restore good comfort while maintaining nutrition.